Are you having knee pain when you're doing things like squatting, going up the stairs, and sitting for a prolonged period of time right behind that kneecap or around that kneecap? What's up, everyone? RJ here, an orthopedic physical therapist. I'm going to kind of explain about that knee pain you're having. We're going to talk about PFPS, or patellofemoral pain syndrome. Depending on your age and what you're doing, a lot of different ways can be that front knee pain. But for this one, we're going to kind of talk about what I just mentioned earlier. And what that is it could be a lot of things like muscular imbalance, overuse, overload, muscle and hip weakness in the knees, quadriceps, hips, whatever. And so let's kind of go over it, some exercises for it, kind of do some load management as well, and some quick things you can do kind of decrease that pain as you help restore your knee and your hips, kind of decrease that pain. Starting with isometrics is a great way to calm down that source of pain. Kind of put the weight to a max weight where you're not going to lift it up and hold it about 60% of your power. A wall at home, just like when you're a kid in timeout, wall sits. Usually 5 times for 45 seconds is a good starting place. Kind of find that comfortable range. You might need to go a little higher up. You can probably tolerate a little lower. You want to feel that contraction in the quads. Now, research does see that if we do this kind of multiple times throughout the day, maybe 3 to 4 times throughout the day, is better for isometrics. Want to help push blood into these knees and tendons to kind of help everything heal, while without having to move the quad in that range of motion that gives us pain. So wall sits and isometrics are a great place to start. We can start progressing to slants as low as possible where we feel minimal pain on a slant board here to kind of take pressure off of the knees as we go down. Moving on to some Spanish squats. These are great. We can loop it between our knees and kind of go down where we feel minimal discomfort as well, and have those bands pull us forward as we squat down. At the top, make sure we pull the knees back and feel that isometric contraction of the quads at the top. This is a great way to kind of progress. Moving on, I think step downs are great as well. We can start as a little step. We can start on the heel, tap to the toe, or tap the whole foot, and eventually move up to a bigger step as well. Get more depth as our quads get better. Moving on to like a lateral step down, same thing as well. Really step up nice and slow, contract those quads, hips, and kind of feel like that low back is kind of kicking on to help contract as well. Lateral step ups is a great way to kind of more progress, kind of get the hips involved as we continue. Next up, we're going to move on to the bridges. Are a good exercise. Get the knees bent, lie on a couch, bed, floor, whatever you're comfortable with. Come on up, hold it a couple seconds, come back down. If we have a TheraBand, we can wrap the TheraBand around our knees and kind of get more of the hip abduction and the glute contraction as well. Come on up, come on back down. So I hope you do find help and relief with these exercises, learn about load management and kind of what the diagnosis is. Stay tuned for more because I'll be uploading more rehab, maybe some high rock stuff, fitness stuff, and whatever in between. See you next time, everyone.